Have you ever suffered from an upset stomach and wondered why? Today we're going to delve into the world of dyspepsia, a fancy term for what many of us simply call an upset stomach. It's something that practically everyone has had to deal with at some point, and it's more than just a minor annoyance. Imagine feeling a distinct discomfort in your abdomen, perhaps coupled with a sense of bloating that just won't go away. Maybe you're also feeling a tad nauseous, and it's all starting to affect your daily routine. These are some of the main symptoms associated with dyspepsia, and while they might seem rather broad, they're key indicators of this common condition. Of course, these are just a few of the many symptoms that can come with dyspepsia. It's a complex issue with a wide range of manifestations. If you've ever experienced these symptoms, then you might have dyspepsia. But what exactly is dyspepsia? Let's find out. Dyspepsia is a common condition that affects millions of people worldwide. But what exactly is dyspepsia? Let's break it down in its simplest terms. The word dyspepsia comes from the Greek words dys, meaning bad, and pepsis, meaning digestion. Therefore, dyspepsia essentially translates to bad digestion. However, it's not a specific disease. Rather, it's a term used to describe a range of symptoms that are centered around the upper abdomen. These symptoms can include discomfort or pain in the upper belly, a feeling of fullness that comes on too quickly when you're eating, or the sensation of being uncomfortably full after eating. Now, it's important to note that dyspepsia is non-specific. This means that it doesn't point to one particular cause but can be a symptom of several different conditions. It's a bit like a smoke alarm. The alarm itself isn't the problem, it's just alerting you to the fact that there might be a fire. Similarly, dyspepsia isn't the problem itself, but it's alerting you to the fact that something might be going on in your digestive system. Also, dyspepsia is a chronic condition. That means it persists over a long period of time. Most people with dyspepsia experience symptoms for at least a month, and often much longer. For some people, symptoms may come and go, but for others, they might be constant. Remember, while dyspepsia is common and often not a cause for concern, it can significantly impact a person's quality of life. Constant discomfort or pain in your belly is definitely not a pleasant experience, and it can affect your eating habits, your sleep, and your general well-being. So, dyspepsia is not a disease, but a sign that something might be wrong in your digestive system. If you're experiencing symptoms of dyspepsia, it's important to talk to your doctor to get to the bottom of what might be causing them. After all, your health is something you should never take for granted. So, what causes this uncomfortable condition? Well, dyspepsia, or indigestion as it's commonly known, can be triggered by a variety of factors. The most prevalent ones are related to our eating habits. Overeating, for instance, can strain our digestive system, leading to discomfort. Similarly, eating too quickly often means we don't chew our food properly, which can cause our stomach to work harder and result in dyspepsia. The types of food we consume also play a significant role. Fatty or greasy foods are harder for our stomach to break down, leading to a higher chance of indigestion. It's not just about what we eat, but also how we eat. Eating large meals late at night or just before bedtime can lead to dyspepsia, as our digestive system slows down when we sleep, making it more difficult to process food. However, it's not just our eating habits that can cause dyspepsia. Stress, in particular, is a significant factor. When we're stressed, our body produces more acid, which can irritate the stomach lining and trigger dyspepsia. This is why you might find yourself with an upset stomach during periods of high stress or anxiety. Smoking is another offender. The chemicals in tobacco can interfere with the protective lining of the stomach, making it more susceptible to acid and leading to dyspepsia. Certain medications can also cause dyspepsia as a side effect, especially those that can irritate the stomach lining, such as non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, and certain antibiotics. It's worth noting that these are not the only causes of dyspepsia. Other conditions like ulcers, gallstones, or gastroesophageal reflux disease, also known as GERD, can cause similar symptoms. However, these are more serious conditions that require medical attention. While these are the common causes, it's important to remember that everyone is different, and what triggers dyspepsia in one person might not in another. So, listen to your body, and if you're experiencing persistent or severe symptoms, it's always best to seek medical advice. Beyond lifestyle choices, there are also medical reasons for dyspepsia. First off, let's talk about stomach ulcers. These are sores that develop on the lining of your stomach, upper small intestine, or esophagus. They occur when the mucus that protects your stomach from digestive juices decreases, allowing the stomach acid to eat away at the tissues of the stomach wall. And this, my friends, can lead to dyspepsia. The discomfort you feel? That's the stomach acid interacting with the ulcer. Next up, we have gastritis. This is an inflammation, irritation, or erosion of the lining of the stomach. It can occur suddenly, which we call acute gastritis, or it can occur gradually, known as chronic gastritis. This inflammation can cause a range of dyspeptic symptoms, such as bloating, belching, and nausea. Imagine your stomach lining as a protective shield. When it's inflamed, it's like your shield is damaged, making it more susceptible to the harmful effects of acid and other digestive juices. Finally, let's talk about gallstones. These are hardened deposits that form in your gallbladder, a small organ under the liver. You might be wondering, what do stones in my gallbladder have to do with my stomach? Well, your gallbladder's main function is to store bile, a substance needed to digest fats. When gallstones block the flow of bile, it can cause a sharp pain in your stomach, often mistaken as dyspepsia. So there you have it. Stomach ulcers, gastritis, and gallstones are just some of the medical reasons that can lead to dyspepsia. It's not just about what you eat or how you eat, but also about the overall health of your digestive system. Remember, dyspepsia is often a symptom, not a disease itself. It's your body's way of telling you that something's not quite right in your digestive system. So, if you're experiencing ongoing dyspeptic symptoms, it might be time to have a chat with your healthcare provider. Understanding the medical reasons behind dyspepsia is the first step to managing the condition effectively. Now that we know what causes dyspepsia, how can we treat it? Often, the first line of defense against dyspepsia is lifestyle changes. This can mean adjusting your diet to avoid trigger foods, such as fatty or spicy dishes. It might also involve eating smaller, more frequent meals, rather than 3 large ones. Additionally, reducing stress through relaxation techniques like meditation or yoga, and maintaining a regular exercise regime can help alleviate symptoms. In terms of medication, there are a variety of over-the-counter options available. Antacids can neutralize stomach acid and provide quick relief. H2 blockers can reduce the amount of acid your stomach produces, and proton pump inhibitors also decrease acid production, but work by blocking the enzyme in the stomach wall that produces the acid. For more severe or persistent cases of dyspepsia, your doctor may prescribe stronger versions of these drugs or other medications, such as prokinetics, which help your stomach empty more quickly, or antibiotics if your dyspepsia is caused by an infection. In some cases, if dyspepsia is caused by an underlying condition like a stomach ulcer or gastroesophageal reflux disease, doctors may recommend surgery. For instance, if an ulcer is causing the problem, a surgeon might remove it. If the issue is gastroesophageal reflux disease, a procedure to strengthen the valve between the stomach and esophagus might be suggested. However, it's important to remember that treatment should be tailored to the individual. What works for one person might not work for another, and it's crucial that you discuss your symptoms and treatment options with a healthcare professional. In conclusion, treating dyspepsia can involve a combination of lifestyle changes, over-the-counter medications, and in some cases, prescription drugs or surgery. The key is to find a treatment plan that works for you and to follow it consistently. Remember, if you frequently suffer from dyspepsia, it's important to see a doctor. Self-diagnosis can lead to unnecessary worry and incorrect treatment. So, to recap, we've journeyed through the world of dyspepsia, a common condition that many of us have experienced as an upset stomach. We've learned that dyspepsia is more than just a simple bellyache. It comes along with a host of uncomfortable symptoms, like bloating, heartburn, and nausea. We've also unraveled the common and medical causes behind dyspepsia. Everything from overeating and stress to more serious medical conditions like peptic ulcers and gallstones can be the culprits behind that unpleasant sensation in your stomach. Lastly, we delved into the various treatments available for dyspepsia. Simple lifestyle changes, over-the-counter medications, and in some cases, prescription drugs or medical procedures can help manage this condition. With this knowledge, you can better understand and manage your dyspepsia. But remember, when in doubt, always consult a healthcare professional. Thanks for watching.